Thank you, Christian. I'm going to ask just a couple of follow-up questions, and then we're going to open it up to the audience. So start thinking about what questions you want to ask our panelists. First to Ray, Ray, just to give you a sense of how successful you've been. I remember when we were in the malaria vaccine initiative, initially trying to scope out the trial for this phase 3 trial of RTSS back in 2005. Our original sample size projections were about 8,000. And we've had to enroll almost 16,000 because of the progress you've made in cutting transmission with the existing tools, which has driven up the research and development costs, by the way. But what I'd like to ask you is, as you mentioned in your opening comments, we've set globally, we've set a very ambitious goal through the Global Malaria Action Plan of near 0 deaths by 2015, which is just 4 years away. So what do you think are the biggest threats to not achieving that goal?
There are a number of threats. We have to sustain the progress we've made to date, as Admiral Zimmer said. And that means we're going to have to be replacing over 100 million meds per year. And that's going to require significant funding. We have to be cautious and concerned about the monotherapies that are still going on in Asia and in Africa. The African Leaders Malaria Alliance has been very effective. That's an organization involving 39 African leaders that have decided to take responsibility for malaria back to Africa and not just rely on paternalistic intervention by those of us in the West. They've really taken on shaming each other not to allow importation and sales of monotherapy, artemisinin. Then we're going to need funding close to $2 billion a year or more over the next 4.5 years to reach that goal. Some have said as high as $6 billion, but we think we can do that at $2 billion. We have to watch the resistance, not just for the medication, but for the insecticide on the nets as well. We're all anxiously awaiting the vaccine that will greatly reduce the pressure on these other tools. And we don't have a strong fix on the utilization of nets. We know in some places like Zanzibar, it's close to 100%. But we know in some other countries, perhaps Angola, where it's less than 50%. So we have to keep up this communication, awareness-raising campaigns to make sure that people are using the meds, because as crude as they are, they work because the mosquito generally bites after 10 o'clock at night. And when the mosquito lands on the net, because of the insecticide, the mosquito dies, and that disrupts the whole reproductive cycle. And malaria, we were able to get into the spotlight, and now it's starting to fade a bit, replaced by maternal and child health. So we're working closely with the advocates of maternal and child health that malaria is an important intervention, perhaps the most important early win toward reducing infant and maternal mortality. But all of this keeps calling for more cooperation, more collaboration, and even as donor countries are affected by economic hardship, that others might step up, that there might be more efficient ways of spending money. I think if we can have the perfect storm of all of those good things come together, then we could overcome the challenges that would prevent us from reaching that goal of near 0 deaths by 2015.
Thanks, Ray. Admiral Zimmer, maybe another question about success for you. As we've seen real progress with malaria control in places like Zambia, Zanzibar, a variety of others, what have you seen in terms of some of the challenges of maintaining the political and financial commitment when we go from the rapid scale up of control to when countries like Zambia have relatively few deaths from malaria as a consequence of their success? How do we build that sustaining that control when malaria doesn't become as visible of a problem? And I think we're beginning to see that in some of the most successful countries.
Yeah, I think what you've asked is really a leadership question. And that applies to businesses, it applies to your families, it applies to everything. And in this case, we're talking about malaria. How do you sustain, how do you achieve your goals? How do we eliminate malaria as a public health risk sometime between now and the next 20, 25, 30 years, depending on who you talk to? You got to have a plan. And that plan can't be our plan. It's got to be the national plan, the country's. And it's got to be short-term as well as long-term. And I mean, all you have to do is reflect back 50 years, and you know there were 200 endemic malaria countries. Today, there are 104, okay? That's a lot of progress in 50 years, but it's not enough when you look at the deaths. So what has to motivate us to stay with a plan is to have an international plan as well as a national plan to the specific countries, and then have the partners look at ways to support each national plan. We all have different interests in different countries. There are many countries we don't work in that our colleagues, folks from the UK or France, are happy to work in. So we collectively have to partner on behalf of the world's community to achieve an outcome. Can we achieve no deaths by 2015? Is it mathematically possible? Yes. If you go back and talk to my technicians, they're rolling their eyes because they feel accountable to producing the outcome. And what we have to do is make sure that we don't personally own it, but we all contribute to achieving it. And I think it's leadership in selling it based on money, plans, commitment, and we have to be part of the advocacy community as well as the scientific. And I'm not dissuaded over this audacious goal of 2015 to near zero, zero, or almost zero deaths. We can achieve it, or we can get very close to it, and either one of those is an excellent thing to do. So I think it all boils down to leadership, a plan, resources, and partners all coming together and staying focused.